Hello and welcome to the on-record portion of the Rockbridge Report. I'm Mickey Gorman, and here with me today is the Rockbridge County Emergency Coordinator, Robert Foresman. Thank you for being here, Robert.
Thank you for the invitation.
Now, I just want a little background on your position, the Emergency Coordinator. How did you find yourself here?
Well, actually, I started out back in 1981 as a volunteer with the Lexington Fire Department. During that 25 years in there, I maintained a full-time job working in public education at secondary level. I was working in Roanoke when this job came available, and I had just gotten tired of the drive. And so I figured with my 25 years of experience in the fire service, it would be a good fit. And I applied for it and was fortunate enough to be given the opportunity.
Now, was it a position that was created and previously existed, or?
Yes, this position had been created back in the 90s, and actually by state code, every locality is required to have a director of emergency management and also to have a hazardous materials coordinator. So what they did with this position was they made it the hazardous materials coordinator and also the emergency management coordinator who works under the director. And the director is actually the county administrator.
Now, what exactly do you do for the county?
Well, my main responsibility is to ensure that we are prepared for any man-made or natural disasters that could include floods, hurricanes, tornadoes, severe windstorms like this past summer, snow events like the one of last week, and that involves writing an emergency operations plan, which is required by the state of Virginia, has to be updated every 4 years. Also, I'm responsible for administering grants for the county through the Department of Emergency Management. And I also have to respond to motor vehicle accidents on the interstate that involve tractor trailers or involve the interstate being shut down for a long period of time.
Now, Rockbridge County last week went into a state of emergency with the snowstorm. Can you walk me through the process of how you dealt with it?
Sure. We had been monitoring the potential for the storm for about a week. And as it got closer into Tuesday, we were feeling more and more comfortable that the storm would hit and that it would be a large amount of snow. And by Tuesday afternoon, we knew that it was going to be a very heavy, wet snow. Tuesday night, I continued to monitor the storm, was trying to send out as much information as I could via Facebook, Twitter, our alert notification system. And then as the snow began to stick Tuesday night, I was up early Wednesday morning ensuring that we had not had any problems up to that point, major problems. And then we got together about 10 o'clock on Wednesday morning because of the amount of snow and the people losing electricity. We went ahead and opened our Emergency Operations Center, which is the coordination for the entire county during these local disasters. And at about 12:45, the county administrator and I spoke and made the decision that we needed to declare a local emergency so that we could get any state assistance that we may have needed.
Now, I think it's interesting you mentioned that you have a Twitter account. Is that something that you thought to utilize, or is that something that?
Well, that is something, once I took this job, we were looking for different ways to be able to communicate with the public, and we were able to purchase back in 2008 a mass notification system, and we thought that would be very beneficial to the residents in the area. But then I realized and continued to get some education on social media, and we realized that there's a large population that stays connected through social media. And so we created a Facebook page for Rockbridge County Emergency Management and also a Twitter account, because we've really felt that to reach that group of people from 40 and below, we needed to make sure we were connected with them.
Now, how did you deal with the derecho windstorm that came through over the summer?
Well, that was a little bit more difficult because the widespread outage, and not everybody has a smartphone, so they're not connected to the social media.
Right.
We were continuing to push information out that way, realizing that a lot of people were not able to access it. Also, we were using our mass notification system, which did a good job. But in something like the derecho, you really have to go back and think about the way to do it in the old days, which is pencil and paper.
Now I understand there's also a potential for a $12 to $15 million project to revamp the 911 radio communication system?
There is. This is a process that's been going on since 2011. We had a consultant come in, do a needs assessment, and guide us through the process of what we needed with the radio system. Right now, we're waiting for the request for proposals to come back from the vendors to see how much the actual cost is going to be, and then we'll work with our consultants and with each of the localities to trim down the cost the best we can.
What are some of the problems with the system that we have now?
Well, it's a very unreliable system. When we had the consolidated dispatch, we really just took two radio systems that were not compatible and put them together and tried to make them work. And really, we're putting our first responders and citizens in danger because there's a lot of areas in the county where they can't communicate, and we're continuing to see more and more problems with the infrastructure of the system.
You mentioned the infrastructure of the system. Is there a standard that the radio system has to meet?
Well, there is a standard. The public safety standard is 95-95, which means that 95% of the time that you are able to communicate with the dispatch center if you're inside a building within a locality, and that is not happening right now.
What kind of areas are we failing in Rockbridge County?
Well, it's very widespread, and what you're seeing is some of the areas that exist between two large hills or between the mountain ranges, the signal almost has to be line of sight, and we're getting interference from the radio system itself. The northern part of the county interferes with the southern part, so we need to correct all those problems.
And I understand that there are more regulations that Rockbridge County needs to fix, specifically the EMS.
There are. Back in October of 2012, the Office of EMS passed the new regulations for agencies that are providing medical services. And there are a lot of new guidelines that have come down that these agencies have to follow, and it makes it very tough on volunteers.
What are some of the impacts that'll have on volunteers?
Well, the biggest impact, it's going to require more time. And that is something volunteers don't have. We're starting to see volunteers leave the system now nationwide because of the amount of time that is required for them to do training or paperwork. And that's what we're trying to prevent, because your only other option, if you start losing large numbers of volunteers, is to bring in career staff. And if you do that, it costs a significant amount of money, and that is something that we don't have right now.
What are some of the other major changes that these regulations would bring to the county?
Well, each agency is going to be required to have a local response plan, which means from the time they're dispatched till the time they're on scene, they have to, have a number that they can meet 95% or 90% of the time. Along with that, they have to have new policies regarding driver eligibility, changes in driver status. They also have to have a provision in there regarding punishments or consequences should they violate a rule of driving, and also they have to have sexual harassment policies. They also have to be able to have a policy for the testing of illegal drugs, substance abuse, and all of these are just becoming very onerous on the volunteers.
And what are the repercussions of not meeting these regulations?
Well, there are several repercussions. The agencies themselves could get a warning. They could have their license suspended for a period of time. They could have their license revoked, or the Office of EMS could institute a $1,000 fine per offense per day. And that also applies to the individual providers. So we're trying to make sure we get all this up to standards so our volunteers are not put in that situation.
Well, I believe that's all the time we have for today. This has been an on the record portion of the Rockbridge Report. I'm Mickey Gorman.